Hello to everybody on a morning that is rather chilly here in central Kentucky. Anyway, I hope everybody's nice and chipper this morning. We've got some good information that I hope will be of interest to everybody. We're announcing and releasing a poll today that was conducted by the University of Cincinnati. It was conducted from the middle of February to the middle of March. 800 people were surveyed randomly. It is a scientific poll, and we've got a number of interesting results. One of the most interesting and most encouraging is that we come away with the idea that Kentucky has a shot at herd immunity. And we're going to be talking a little bit about that and about how the poll results lead to that conclusion. We believe that there is opportunity here in Kentucky to grow the COVID-19 vaccination rate. The poll sheds light on which people are more likely to be vaccine hesitant, whom in that group is open to potentially changing their mind given time and given more information, and what motivates people to get the vaccine or not to get the vaccine. Combined, this data will inform how we reach out to people to encourage more Kentuckians to roll up their sleeves and get vaccinated. And I think we all understand the importance of that. I don't know that I need to belabor it tremendously, but herd immunity is essential if we're going to get through this pandemic and get back to something that we're familiar with in our lives here in Kentucky. The poll shows that 71% of Kentuckians had either already or intended to take the vaccine. Now, that gets us, if everybody follows through, that gets us almost to where we need, right at the edge of what we need to achieve herd immunity here in Kentucky. You have to look at the poll, of course, in the context of where we were when the vaccine rollout happened and when the poll was taken. The poll reflects what was happening at that time. Essentially, when the poll was started, the 1C category had just opened up to people 60 years old and older, and not yet to the 16 plus folks and so forth. Now, the most recent numbers that we have, and of course this isn't exact, but the most recent, according to state data, is that we just got over 50% of all adults who have had at least one shot. So that in and of itself is very encouraging news, I think. More likely, the people who are more likely, and this is where we get into the meat of the numbers, more likely to take the shot or who have already taken the shot include women, 76% of women, 87% of Democrats, 70% of independents. People living in urban communities are 80% likely to have either had it or intend to have it. College educated people come in at 81%, and people with some college are at 77%. So those are the groups who are more likely to get the vaccine or who have already gotten it. Now, the folks who are less likely, the folks who have more hesitancy, and these numbers we think are very interesting. Being a man, it doesn't surprise me that men come in as much more hesitant than women. Men are 34% hesitant. You know, we don't make very good patients. My wife tells me that all the time. Republicans at 43%, that means 43% of Republicans are hesitant to take the vaccine. People living in suburban communities come in at 35% hesitant. People living in rural communities are 34% hesitant. And people with a high school diploma or less than a high school diploma are also hesitant. Those with a high school diploma are at 34%, and those without a high school diploma pretty high, 46%. And we were a little surprised at how high that number was. Of those reluctant to take the vaccine, and this is where the good news comes in, I think, half of them were open to changing their mind with time and with more information. And included in the hesitant groups of Republicans, 47% of those Republicans who were hesitant are open to changing their minds. 50% of the people who live in suburban communities are also open. 53% of people living in rural communities are open, and 53% of high school graduates are open to changing their minds. So I think that's very good news, and that's key, really key to our chances of achieving and approaching herd immunity and getting back again to living our lives. We need these folks in order to get there. Now, the motivation, this is another interesting thing, I think, and we asked this question, why would you be motivated to get the vaccine? Is it because of personal reasons, or is it because of your concern with the community and the health of the community? And the people who said that it was for personal reasons, they tended to be the same group of people who showed up with the highest numbers of hesitancy. 74% of the people with less than a high school diploma, it was about personal reasons. 64% of the Republicans were in that category. 54% of independents, that's a little bit of a shift, and 55% of rural communities. Now, the people who primarily looked at their community responsibility, their responsibility to making sure that the community was safe by taking the vaccine. People with some college background, 57%. People with college degrees, 54%. Democrats at 71%. And urban communities at 56%. So this insight into the motivation tells us really the sorts of things that we need to focus on when we're making our pitch to those people who are hesitant and whose minds are open to actually getting the vaccine. We need to message to these people, I believe, and we need to see if we can get them turned around. So those are the top lines of the poll. And with that, Ashley, I'll turn it back over to you.
Thank you, Ben. Want to bring in Allison Adams now, who is the VP for Policy with the Foundation for a Healthy Kentucky, to talk a little bit more about what this poll means for our state.
Good morning, everyone. Thank you for joining. First of all, I just want to draw your attention. I'm sure that you've seen the campaigns that the foundation has coordinated in response with our community partners. The Kentucky Nurses Association has sponsored and partnered with us with the I Got the Shot vaccine PSA, which features Black Kentuckians naming and responding to common concerns, with the ultimate goal, of course, is increasing the confidence in the vaccine as well as Kentucky vaccination rates. So before the poll was, before we were able to get the results of the poll, the foundation has been working with our community partners to have our campaigns to begin to shift and move Kentuckians towards the willingness to roll up their sleeve and receive the vaccine. And the other campaign is the Take It From Me, which is a partnership with the Kentucky Nurses Association, the Kentucky Hospital Association, the Kentucky Medical Association, and the Primary Care Association. And this was an effort to identify trusted messengers of who people would trust in moving them or motivating them to receive the vaccine. So the foundation, prior to the poll being concluded, we were able to produce 2 public service announcements and campaigns for the use of our community partners to help move Kentuckians towards rolling up their sleeve again and getting that vaccine and heading our way towards achieving herd immunity. So what's exciting for me from the policy perspective and the opportunity for the foundation and all Kentuckians is, first of all, as we heard from Kentuckians, it's exciting that the fact that half of the people who initially said they don't intend to get the vaccine are open to reconsidering given time and more information. And so this gives a lot of hope to whether or not, like Ben said, Kentucky's got a shot at reaching our herd immunity. This is something that the foundation is committed to working to helping our partners share resources and information that speak to the vaccine hesitant Kentuckians. And so we are excited to release this information so that our partners can use it in order to build their campaigns and target their messages and messengers to Kentuckians who have the need for more information and can are undecided really and intend that they might be able to take this vaccine. So the foundation wants to build those collaborations, and we want to be here to help use this information to help build local campaigns around the information that we know has the potential to move Kentuckians to receiving the COVID vaccine, and helping you craft your message using the results of this surveys to know where we have the hope of moving certain subgroups and rural and urban communities, male and female, how we can begin to customize our messages to our target audiences. And then most especially opening up the lines of communication, making sure that people feel safe to ask the questions that they might have that it determines whether or not they will take the vaccine, and making sure that it's an informed decision and providing them with the information that they need. And most important, that it's okay to ask. It's okay to have the questions and making sure that you ask those questions. So we know what we learn and what we feel like we want to move on with our new opportunities for public campaigns or media platforms is we know that young people need to get vaccinated. We know that they are essential for Kentuckians to achieve our herd immunity. We know that we have an opportunity to reach out to the Republicans in Kentucky, that there is an opportunity for us to figure out what we need to make sure that they have all the information to receive the vaccine. And also it helps us and the community to guide our strategies and how we outreach these groups. Who are the trusted messengers and what are the messages that they need or the questions asked in order for them to change their mind and intend to take the vaccine. So I just want to make sure that you all are aware, and Kentucky is aware, that we do have these two campaigns that the foundation is very proud of, not only for the fact that we have produced those based on focus groups and Kentucky information and answered questions, the common questions about the vaccine, but also that we were able to build a collaboration with the Kentucky Nurses Association, the Primary Care Association, the Hospital Association, and building these campaigns so that we can get them all across the state of Kentucky. So I'm looking forward to your questions. And again, we hope that this information will be of use across the state to build campaigns and help Kentucky achieve that herd immunity we're all striving for, to get back to enjoying our lives that Kentuckians love to live.
All right, thank you, Allison. Our first question is from Debbie Yetter with the CJ. What do we consider herd immunity to be?
Public officials generally put herd immunity anywhere from 70 to 85%. It's a moving target, but within that range. And what's hopeful about this poll is that, as I mentioned at the outset, 71% of adults indicate that they are likely to get the vaccine or already have gotten it. So where adults are concerned, that really moves us very far in that direction toward herd immunity. Now, that's just among adults. We've still got a larger overall population. So we've got to get more and more people vaccinated. It's not an exact thing, but the more people that are vaccinated, the less place that the virus has to go. I think we understand that the virus, in order to snuff the virus out and give it less hospitable places to live and mutate, we need to get to that herd immunity figure. And the reason that's particularly important is that if this virus mutates and is allowed to continue to produce these variants, at some point there's a tremendous concern that the variants may outpace the vaccine and inhibit the efficacy of the vaccine. So that's really the key import of what we're trying to do here.
Okay, next we've got Paul Miles from WHS Radio. Wants to know, Ben, why do you think certain groups are more hesitant to get the vaccine, specifically Republicans, rural residents, and those who are less educated? And why are those same groups motivated more by personal choice to receive the vaccine?
Well, I think a lot of it has to do, frankly, with the messages that they've received. And as you know, we have a very splintered media environment now in this country, and different groups of people, and this has been well documented, different groups of people get different media from different sources. And there are people out there, there are anti-vax groups, there are political groups who want to talk about this. There are even elected leaders, frankly, who don't push the vaccine like they should, and sow some doubt in people's minds. And I think that's a big problem. I think it also is associated, frankly, with doubts about COVID-19 itself. We've been dogged by that throughout the process, that maybe this virus isn't as serious as people are saying it is, that sort of thing. But of course, I'd point to 560,000 deaths or whatever it is and the families who've been affected. I think it's, in my opinion, well documented that this is a considerable issue and a considerable problem, and a tragic thing that we've got to get beyond, not to mention the damage to our way of life and the economy. The risks that we have seen, some risks, even though some of them are very minor, of the vaccine. The Johnson & Johnson issue just being the most recent one, I think also contributes to this hesitancy. And what I would say about that is that the numbers are really minuscule, and the authorities are trying their best, I think, to be transparent with the public, and they are making decisions with an abundance of caution. They really are. And the vaccine in and of itself, when you look at the numbers, and I think I saw somebody saying, some authorities saying on television in the last couple of days, that you're much more likely to walk out in the street and get hit by a car than you are to have any real trouble with the Johnson & Johnson vaccine. But that being said, the authorities are moving with an abundance of caution to do what they can to make sure that it's safe. And I think there's also a lack of confidence in the development of the vaccine, the approval process, due again to politicization. I think the politicization of this is what is worrisome, and we've seen it all across the spectrum. You've also got some issues in certain communities about the medical system itself, and some of these are historic in nature and have been well documented. So it's a variety of reasons, I think.
Melissa Patrick would like to know, she says, I've recently talked with several health department leaders who have said they are using social, radio, TV, and local leaders to get people vaccinated, but they're struggling to get slots filled. What should they do next? Allison, do you want to take that one?
Sure. Struggling to get slots filled, even though they have, they're doing their very best to get out the messages and the messengers. And my response would be that we know that the vaccine is available. We know that there's people who need the vaccine. Is how do we dig deeper into recruiting our messengers? We have a pretty good idea of why people are hesitant. Ben just kind of went through those. And how do we dig deeper into finding those trusted community messengers? We know that there are social influences in all 120 counties in Kentucky. So how do we continue to launch this public campaign of recruiting folks to to receive the vaccine. So I think that as we work across the state of Kentucky, we keep honing in our message and digging deeper and deeper to reach the hard to reach populations.
And following up on that, Victor Puente says, ask how, have there been any conversations with Republican leaders in Frankfort about reaching out to members of their party?
I don't know the answer to that question. I mean, that's one that'll have to be put to the governor.
We've got several questions about the Johnson & Johnson with the pause yesterday. How is this going to play out? How might it impact our ability to achieve herd immunity?
So
go ahead, Allison.
You know, obviously it's a concern for the fact that, people will have that seed of doubt. Ben talked about earlier in regards to there's risk for everything. So I think the most important thing is we've all have learned over the last year that things are ever changing, and we just encourage if you have questions regarding the J&J vaccine, when the pause is there out of an abundance of caution. We know that we hope that it will they'll learn what is the cause or the reason behind some of the adverse effects that are happening, and we'll be able to be truthful, number one, and let people know what was the reason and why that is a risk, and what are the risks versus the benefits of receiving the vaccine. And I just encourage folks to, again, ask the question, what is concerning to you about any of the vaccines, and making sure that you keep digging until you find that answer that you're comfortable with. And, we have trusted websites. The CDC has information regarding the J&J vaccine, as well as, reaching out to the Kentucky website that has been operational since then. Again, trusted sources and resources out there. But I think what's most important is letting people get the information that they need. So we need to be answering the questions about all the vaccines, being truthful with the information. And I think, it should be well apparent that the Centers for Disease Control and HHS and those that are responsible for the vaccine are watching out for our best interest, and they're pausing. That's the reason why we have reporting systems in place. It really shows that the public health system works in regards to building infrastructure and information, so that adverse effects like this can get reported rapidly. We can pause and we can respond appropriately. So I think that, it's a concern, but it's definitely one that's not overcomable, and Kentuckians should continue to ask the questions and roll up the sleeve whichever vaccine is available to them.
Alex Kisto with the Herald Leader asks, when we polled people for their reason choosing to or not to get the vaccine, how specific did we get? When people cited personal reasons, for instance, did the poll probe what those were? Was there any gauging of how misinformation was fueling hesitancy?
No, we did not get into that kind of detail. It was just too cumbersome to try to delve down that deeply. But I think, judging by a number of the questions that I've seen in the chat box, the real issue here is, what is the way forward? What are we going to do to push up the number? And I think the bottom line is that this poll gives us some general information that we can move forward on. It talks about which groups need to be targeted primarily, which groups are open to changing their minds, which ones are hesitant, which ones of those are open to changing their minds, and whether personal considerations or community considerations are the sort of messages that will move those folks. I think that the way to go is to get down to the local level. We're going to have to dig this out, I think, at the local level. We're going to continue to have to involve local public health officials and leaders throughout the communities. We're going to have to point people throughout the state to the people that they see as trusted messengers, not just the message, but the messenger. And we're talking about faith leaders, Again, we're talking about local public health officials. We're talking about your doctor, your own primary care physician, people who you trust at home, residents of the community who have gotten the vaccine, who you have some faith in. We've got to look at those people, and we've got to encourage those people to speak out about this to their local communities. And that's really what the foundation's campaign has tried to focus on. We've tried to get local Kentucky citizens to talk about why this vaccine is safe and why it is extremely important, both for personal reasons and for community reasons. But it's going to take some effort, and this is a challenge. I don't think anybody suggests otherwise. This is something that nobody has ever tried to do, frankly, in the history of mankind, to vaccinate people on this level at this speed. So just because we're having some hiccups and some challenges, as I said, is not a reason to get discouraged. I think we've got lots of hope here. I think this poll gives us hope. And I think if we adopt the right strategies and measures, we've got a real shot at getting where we need to be to herd immunity.
We've got a couple of more questions here. Paul Miles says, what is the greatest challenge in getting your message to those who are hesitant and convincing them to get vaccinated?
Well, I mean, I think the challenge is related to a lot of things I've just mentioned, but it's the competing information, I think, and misinformation that are out there in the whole network, the atmosphere. You know, we've got to overcome that, and we're battling, in my judgment, my personal judgment, we're battling a considerable amount of misinformation, some for political reasons. I think we've seen some politicization of this, as I alluded to earlier. And, you know, you've got a built-in anti-vaxxer group. You've got a distrust of government that has been sowed over the years, probably 50 or 60 years. And frankly, to some extent, since the beginning of the country, you know, back to revolutionary times, I think there's been a feeling that the government is suspect on some level by the citizens of this country. So we have to overcome, I think, an ingrained feeling here in the country of suspicion. And again, I point to, in my judgment, what we ought to be doing, and that is reaching down to local leaders, to local trusted people, folks that citizens know, to speak out, to have their voices amplified, so that people will have confidence in getting the vaccine. It's not going to be enough, frankly, for the government to just sit there and tell them that they need to get the vaccine because of the distrust. You've got to engage and employ other folks in the community, and employ them in a major way, in my judgment.
So I think this is the last question here. And Allison, if you want to run down where people can find that most reliable information again, and then also just want to bring everybody's attention to there is a free webinar tomorrow morning at 10 that is all about tools for increasing COVID-19 vaccine uptake. The registration link is in the chat. I've also put the link to the news release in the chat, and there are downloadable graphics on that page as well. So Allison, if you'll take us home.
Sure. So trusted resources, of course, you know, we know that there's the trusted websites out there, Kentucky specific, the COVID-19, the website that's put out by the Cabinet for Health and Family Services in partnership with the governor's office. Also, we know the Centers for Disease Control, CDC.gov, and then the Health and Human Services, HHS. And you're seeing those, you know, the common information, consistent messaging, and updates in regarding what are we seeing out of how many people are getting vaccinated, and what are some of the adverse experiences, and those, and the positive things as well as, what has helped people prevent disease and prevent hospitalization. So good information there on trusted resources. And then also your local public health departments. I can't stress enough the amount of information that you can get at your local level. There's a health department in all 120 counties in Kentucky, and all of them have reliable and trusted information about each of the vaccines that are available at the county level. And then finally, what is the most trusted resources? The people that you trust the most, right? So I'm just saying, in regards to vacant appointment slots that are out there all across Kentucky, it's important to recruit your family, your friends, your neighbors, and strangers to receive their COVID vaccine. This is the time for Kentuckians to do what we do best, and that's care for one another and recruit us all to giving the right information, being willing to ask questions, and being willing to answer questions, I think is most important. So I think, like I said, Ben said it very well. Kentucky does have a shot at reaching herd immunity, and this poll shows it. And I encourage all of our partners across the state to use this information to craft your message and find the messengers at the local level. So thanks again for joining us today, and we look forward to continue working with you to help Kentucky be as healthy as they can be.